We're going to do some special tests related to the rotator cuff. The first special test will be the Neer impingement test or Neer impingement sign. With this test, you can do it either with the patient sitting or they can be lying supine. What the examiner does is, this is a passive test for the patient, so the examiner is doing all the movement. And what the examiner does is puts the shoulder in full internal rotation and then elevates fully in the plane of the scapula. I'm stabilizing posteriorly just so the scapula doesn't move back. And then I'm going into full passive elevation in the plane of the scapula. A normal response would be no pain, no discomfort with this test. A positive response would be pain that's typically felt in the superior anterior region of the shoulder, right in here, at typically towards the end range of the testing. The next impingement test is the Hawkins-Kennedy test, and with the Hawkins-Kennedy test you want to position the patient in 90 degrees of flexion. You start out in a neutral rotation, and then again this is a passive test, so the patient just relaxes, and then the examiner will bring the patient's shoulder into internal rotation, and typically it's kind of a coracoacromial impingement test. And again, a negative sign would be no pain, no discomfort with the test. A positive sign would be pain, typically on the superior anterior region of the shoulder. And then the last one, looking at cuff integrity and rotator cuff impingement, is the empty and full can. So you want to start out with the empty can. The patient's in full internal rotation. They're in the plane of the scapula. You can have the patient hold there, and then you can resist. And they should be strong. There should be no pain. And then you can bring them over into full can, and then resist. And they should be strong, and there should be no pain. So pain in the area of the supraspinatus may indicate a positive test, or weakness with that test could be a positive sign.